Hey guys, Tony Maritato here, licensed physical therapist, and in this video I wanted to update the discussion about scar tissue mobilization. I've got an old video that I'll link down below in the description, but I just want to update some information. So if you've had a total knee replacement and you're anywhere in the 4 to 6 week range, the incision has likely started to heal or healed up pretty well. Maybe there's a couple spots that are still closing, but assuming you have no sign of seepage, hopefully full closure throughout the incision, I want to talk about scar tissue mobilization as a way to reduce scar tissue sensitivity, improve soft tissue mobility, and just possibly address the healing process of the scar tissue itself. So for reference, most of you have a superficial incision run somewhere down the center of the knee. Some of you are going to have, depending on your surgeon's approach, an internal incision that's going to run around the kneecap, because when they open up the knee, they move the kneecap over to the side. So the internal incision you're not going to see, but you're going to feel most likely. The superficial incision is the one you're really going to see. And once that incision is completely sealed with no sign of seepage, there's a couple kinds of massage techniques that you can use. Now, everything I'm going to show you today is without any kind of lotion. There's common belief around applying vitamin E oil. There's common belief around using other kinds of lubricants and lotions. I'm going to show you a dry rub massage that's going to allow us to move the skin over the connective tissue below the skin, because the goal in this is to keep those layers separate. And what I mean by that is you have the layer of skin, some fascia, then usually other layers that are going down below between the upper layers, lower layers, the muscle, the bone, all of this tissue in here. It's just kind of like layering on, and we want to keep those layers mobile. So one of the easiest ways to start with is what we call a cross fiber massage. And simply put, I take my thumb, I put it right on top of the incision, I apply enough pressure that the skin will move side to side with my thumb. I'm not sliding over the skin. That's why we're not using lotion here. I want the skin to move separate from the tissue below the skin. So I can do cross fiber. I spend 3 to 5 seconds in each area, and then I move the width of my thumb lower. So I work through the entire incision. It might take a minute or two, maybe 3 minutes. If I find an area that's sensitive, quite often the bottom of the incision or the top of the incision might be sensitive. You might spend a little extra time on those areas. We're working cross fiber, but then we can also work parallel. There's usually not as much mobility when you're going parallel with the incision, but I would do the same thing, maybe another 3 to 5 seconds at each level, working all the way down the length of the incision. If I believe there's some sensitivity with the internal incision, although I can't see it, I can do the same thing where I'm just gliding the skin back and forth over what I'm imagining as the internal incision. Now I can do this with the knee bent, but I can also do it with the knee straight. So if I can sit on my couch, sit on my bed, sit somewhere where I can elevate the leg, have it straight, this is usually going to give us a little more laxity in the skin, so that I might get a little more movement with the cross fiber. I might get a little more movement with the parallel fiber. I can also do kind of an opposite with both of my fingers. So in other words, I have one on top, one below, and I'm creating the zigzag pattern. And then I move down a level, create the zigzag. This should all be pain-free. Maybe there's a spot with a little bit of sensitivity, but certainly this should not cause increased pain. I know some patients are just uncomfortable with the sensation. There are other techniques and other strategies you can use if this just kind of weirds you out or gives you the willies. But basically, I would work back and forth, all the way up, all the way down. And then the last one I want to share with you guys today is a skin rolling strategy. Now, if there's a lot of swelling, if the skin is really tight, this is not going to be an effective strategy for you. But one of the things that you can do is basically you apply your thumbs underneath, your index or middle finger on top, and you're just kind of rolling the skin as it goes down. This creates some lift. I've got another video on the channel. If you search for suction cup, it'll probably come up, where I use a little silicone suction cup to create some lift through the incision once it's been completely healed. But this allows me to, again, create a negative pressure, create some lift, make sure that there are no adhesions or restrictions underneath the skin. I can't make any claims to say that this is going to make the incision heal more beautifully or aesthetically pleasing. I do tend to believe that the way your body lays down scar tissue and heals cuts in the skin is more controlled by genetics than anything we can do. Certainly we could probably do things to make it worse, but in terms of making it visually more appealing, I don't think there's a lot that we can do to control that. But that being said, scar tissue mobilization, cross fiber, cross friction massage are great techniques for you to start using once the incision is completely healed and there is no sign of seepage. So guys, if you have questions about anything, I'm also going to link to a couple of the wound specialists that I know, I trust, I work with, because they're really the experts in the field. You know, I am doing the best that I can, sharing the information because I have the platform, but the wound specialists are the ones that really understand tissue healing, skin, and they're the experts that can get you the information that you need if you're dealing with a complicated situation. Otherwise, thank you so much. YouTube is going to recommend a video that you might like watching, so go ahead and click on that, and I'll catch you guys on the next video.